In the next 4 minutes, you'll see my question to the Ontario government in our Parliament today regarding the Great Barrington Declaration. If you want to see how governments are deflecting and distorting what's happening with COVID, tune in to this video. Be sure to like and follow my pages, as well as sharing and tagging with your friends. And let's together change this path that we're on.
The next question, the member for Lanark, Frontenac, Kingston.
Thank you, Speaker. Speaker, seeing that the front benches have emptied, I'll pose my question to the Minister of Long-Term Care. Over 1,300 public health scientists and 1,500 medical practitioners. The document is called the Great Barrington Declaration. It was drafted by professors from Harvard, Stanford, and Oxford, and they are the most respected epidemiologists in the world. Their concerns are singular in focus. The prevailing COVID policies are having damaging physical and mental impacts on the public. They are aghast that the public health advice being provided to Western governments is contrary to the science and what we now know about COVID. Minister, Nobel laureates and reputable world-leading experts on infectious diseases are telling governments what you're doing is causing more harm than good. Will you heed their advice and endorse the Great Barrington Declaration, as I have?
And thanks to the member opposite for the question. As a physician for many, many years and studying science and evidence, it's very clear that there are always differences of opinion, and those differences of opinion have to be carefully considered and thought out. And our government, my Ministry of Long-Term Care, we have been working with the science and the evidence of experts, many experts, hundreds of experts, and the Chief Medical Officer of Health being one of them. There is many areas of evidence that must be weighed and understood, not only at a macro level, but a micro level. So there are many considerations being given, and all of this evidence is emerging. At the beginning of COVID, there was very little information available. Now there is more than most people could ever manage to get through. So the essential caregiver piece, I want to make sure that I repeat this, that our essential caregivers are back into the homes. They are there providing support, the mental well-being of our long-term.
Supplementary question.
I do thank the Minister for her response. However, these preeminent experts have stated government policies are resulting in lower childhood vaccination rates, worsening cardiovascular disease outcomes, fewer cancer screenings, and the erosion of mental health. They state that the current lockdown policies are devastating our short and long-term public health. They are asking all governments to shift gears and move towards a focused protection model that protects those at risk while letting those who are healthy return to a normal life. Minister, will you do the right thing? Follow the advice being given by the most preeminent world leaders in this field, or should the people of Ontario prepare themselves for further lockdowns, more bankruptcies, further medical delays, and now we see forced isolation in detention camps on the horizon?
I reject much of the premise of that question, but I want to reinforce the concept of hope, that we understand what we've been through. We understand the dark days that we've had during COVID-19, the lack of information, working as hard as everyone could to collaborate, consult, and create plan forward. That's what we were doing as a government, talking to our experts as the science emerged. And that's what we need to go forward. We need a level of support for our long-term care homes, for everyone who's waiting for health care. I have tremendous hope, and our government is working with that hope to understand how to make things better coming out of COVID-19. And we will come out of COVID-19. We will come out having lessons learned. We will come out better. Ontarians are all in this together. They're doing their part. We all need to do our part, and we need to stay focused as we move through this in a positive way.